Good afternoon. I am Dr. Maya Bird-Stewart, and thank you for joining us for our podcast. Today we are going to be talking to an well-established doctor, oncologist, Dr. Estela Rodriguez.
Let's go.
And so I know that, when we think about oncologists, hematologists, oncologists, and in particular oncologists, we don't think about, or we don't really know what that means. And so today, Dr. Rodriguez is here to tell us and explain more in detail and give us some tips in terms of oncology and some of the things that are associated with oncology, particularly what's associated with oncology. And without further ado, I will introduce or allow you, Dr. Rodriguez, to just introduce yourself real quick, and then we're going to jump into oncology. What is oncology, the study of oncology, and how does it fit into our lives?
Thank you so much, Mia, for the invitation. So I'm Estela Rodriguez. I'm a lung cancer oncologist, and I take care of patients that have been diagnosed with cancer or have survived cancer. But we also are very much involved in screening for cancer.
Okay.
So we know cancer is a common cause of death in the United States, and we're seeing more younger people being diagnosed with cancer. So it's important that we understand why. So I see patients that have solid malignancies, lung cancer, but there are also oncologists that see patients with hematologic malignancies, which are in the blood.
Okay, okay. And so there is a distinct difference between the oncologist and the hematologist?
Yeah, the hematologist can see a range of diagnoses from cancers of the blood like leukemia and lymphoma to things that are benign in the blood, which are iron deficiency, anemia, thrombosis, which are problems that need to be treated, but they're mostly diagnosed through the blood.
Okay, the blood. Hematology is the blood. Oncology is the lung.
Yeah, the oncology is what we call solid tumors, so any growth that is in an organ. So it could be anything from the brain, anything in the skin. The most common cancers that are diagnosed in the United States are breast, prostate cancer, and lung cancer.
Okay, and oncology is strictly related to cancer. It's not that you'll have a problem. I have an eye problem and I can go see the oncologist. I have a knee problem. It's strictly a cancer.
Yeah, so usually most of the patients that I meet have been seeing their primary care doctor, or they present to the emergency room with a symptom that makes the doctors think that there could be something abnormal. And then once they find those images and do a biopsy, they get diagnosed with a cancer, they get referred to a specialist of cancer. But we're also involved in the prevention of cancer and understanding how we can help our patients not get another cancer.
Okay. So all right, let's go there. You talked about the detection. And so when, in particular, lung cancer, what are some of the symptoms or signs that one should be checked out for lung cancer in particular?
So thank you for that question. Lung cancer is the number one cause of cancer death for both men and women. So there are more women, for example, that will die of lung cancer than breast cancer and the next three other malignancies. So the number one risk factor is smoking, but we are seeing an epidemic of younger patients who have not smoked who are getting lung cancer, and we believe that there are other environmental and genetic factors at play. So it is important for us to understand that, and for also to tell patients and people to tell their family members, if they have a family member who has smoked, there is a test that we have known about that works. It's a low-dose CT scan. It's an image that you get done, and you qualify for that image if you're age 50 to 80 and you have smoked 20 pack years, which is the equivalent of a pack a day for 20 years.
Okay.
And unfortunately, in the United States in general, and in Florida, for example, only 4% of the people who qualify for screening for lung cancer actually get this test. So we are missing a lot of people that we could have diagnosed early. The importance of diagnosing early is that most cancers that are diagnosed early, we can cure with surgery.
Okay.
And we want to meet patients when we can cure them.
Okay. And so when we talk about lung cancer, right, oncology or lung cancer, that too is if you detect or catch that early enough in a stage 1 or a stage 2, maybe even a stage 3, I take it?
Yeah, no, we are making a lot of progress. Even in stage 4, we have patients living with lung cancer and surviving lung cancer longer than they had ever, due to advances in molecular testing and new immunotherapies and targeted therapy. So there's a lot of hope even for the patients that get diagnosed late.
Yeah.
But it is important to diagnose it early.
Yeah. And so you talked about risk factor. You mentioned a risk factor, which certainly is smoking. And then you talked about some environmental. What about family history? Is that also, could that come into play?
Yeah, we are learning, for lung cancer, not as much, but other cancers like breast cancer and colorectal cancer, family history is very important. Also, families live in the same environment. So if you you grow up in an environment that there's a lot of heavy smoking, that whole family is exposed. And if you grow up in an environment that has radon, a high amount of radon in the house, that whole family is exposed. So family history from an exposure and from a genetic part matters for many cancers. And with your primary care doctor, you should be going over your family history. We know that families that have early colorectal cancer should be screened for mutations that are in the family. Families that have ovarian and breast cancer, pancreatic cancer, even prostate cancer, they're familial genes that can cause those cancers.
Okay, got it. Now, we know that this month is Breast Cancer Awareness Month.
Yes.
How does oncology fit into breast cancer awareness or breast cancer?
Yeah, so breast cancer is a great example of a cancer that we have made a lot of headways in some communities, not all, with screening. So the majority of women in the United States who get diagnosed with breast cancer are cured because they are diagnosed through mammograms early, and they can get these breast lesions resected, and then they get on treatment for prevention. But we are seeing younger women, especially African American women, who are presented with very aggressive breast cancer, where we don't have an opportunity to even screen them because they're outside of the screening criteria. So it is important for us to understand why, and and talk to women about getting that mammogram. And now the new guidelines are that, especially for Breast Cancer Awareness Month, that women know that starting at age 40, you should be getting a mammogram every other year, because we have seen a rise of breast cancer in young women about 0.4% per year. So there's very important that it's not a problem for your mom and your grandmother, for the woman that is in the middle of their career, to really make an appointment and make it a priority, because breast cancer is a great example that diagnosing early breast cancer, you can get cured.
Okay. And so we've talked about what oncology is. We've talked about risk factors. Prevention, right? And so I guess my question is prevention, certainly from lung cancer. You mentioned one, but prevention from cancer in general, is that a possibility?
Yeah, it is a possibility, because we have seen that one of the reasons why there's more cancers being diagnosed is that there's an epidemic of obesity, and that causes a lot of inflammation. So there's a lot of risk factors that have to do with lifestyle and a sedentary lifestyle, not moving, not doing exercise, that increases your risk. So prevention is also about that. It's about controlling your weight and eating well and not doing things that are going to hurt your body, like tobacco, and also going to the doctor to get checked. So prevention is about doing those things that we know will help. And also there's some cancers that are associated with infection. So for example, cervical cancer, the best way to prevent that is to get a vaccination for HPV when you're young.
I've heard about that.
And to really get routine pap smears when you're young. So there's a lot of ways to prevent cancer, but really a number one way is to move and exercise. So that you're in a better position. Although we have plenty of people who are very healthy, in terms of weight, and they still get cancer, but there is, we think that lifestyle matters. And so, because there's a very, very popular athlete recently. Now, this guy looks like just a perfect example, when you talk about a great bill of health, right? And I mean, tall guy, slim, fit, works out, and recently talked in public about a cancer diagnosis. And it was baffling because of, what we're talking about. I mean, you talk about
health and fitness being, one of the number one ways to prevent cancer. And this individual was doing such, yet he still ended up with, some form of cancer. But you've also talked about it, you've got people that don't smoke, younger people now that aren't smoking, that you're finding, are concocting cancer. So,
so, those are not the most common cases. In the majority of cases, there's a risk factor and lifestyle matters. But there are those cases of people who are living very healthy lives and they still get cancer. But what is important for those are to understand the family history and to really diagnose things as early and be as aggressive as you can be in terms of treatment. So in oncology, the way we treat cancer is number one, surgery. And then we have patients that we add chemotherapy and radiation. And now immunotherapy, which is a treatment that activates the whole body to fight the cancer. There's a lot of new ways to fight cancer, but surgery remains gold standard for cure of cancer.
Oh, wow. Okay. So now you said something. One of my questions is debunking some of the myths, right, about cancer. You talked about HPV. There are pros and there are cons. There are folk that are on the pro side of HPV. There are folk that are on the con side. And not only HPV, just vaccines, right? What are some of the myths, right, in your, expert opinion about vaccines? How should people really feel about them? Should we really research them, or should we listen to our doctors, or should we, go and do our own research? What are some of the myths that you can debunk about whether it's HPV or vaccines in general?
So, I think for cancer, I think HPV is one example. From a public health perspective, we have seen a decrease in cervical cancer in women because we are getting younger, women getting vaccinated. Okay. So there's a direct link there, and it's critical. And the drawbacks are little. I think you bring a great point, because we have patients that think that they got the COVID vaccine, for example, and now they have a cancer diagnosis, and did that trigger the cancer? And there's really no link. We have seen that, patients that got the vaccine are not having an increased rate of cancer. Okay.
I am ex-military, right? And I served in the Gulf War as well. And I have had cancer. I've had the cervical cancer. And so I remember I had cervical cancer in 1992, early on. I was a young woman, I think 22, 23. And I remember back then, hearing about, when you talk about environment, the military, right? Could my environment be potentially, part of the catalyst to the cervical cancer, right?
Yeah, no, I definitely think that things are, cancer is a multifactorial process that takes time to form, and you can't really blame it on one particular thing. Sometimes there's like the genes that you're born with that correct errors in cells work really well in some patients, in some people, and not in others. And then environmental exposures like at war, pollution. We think that some of the rising trends in lung cancer in young people have to do with pollution, and they're definitely highest incidence in countries that have highest pollution. So there's a lot that is not only like something you did, like there's things around you.
Sure. And serving during the war, there were oil fields, hundreds of oil fields that were on fire. And so we were in that environment breathing, that in. But it's like you said, for the military, there has not necessarily been a link, but it has not been shown that there isn't a link, right? And so in terms of myths, so vaccines. You would say, in your expert opinion, that getting a vaccine as it relates to cancers, and so whether it's HPV or any others that may be required, it's a good idea that we are getting vaccines?
Yeah, we think vaccines mostly protect our patients that have been treated with chemotherapy. In terms of prevention, probably the only things that we can prevent really are like, hepatitis that can cause liver cancer, and HPV that can cause head and neck cancer. You mentioned cervical cancer, but we have a very high group of patients that get HPV in the mouth and in the oral cavity, and that's also a transmitted disease that is virally related. So those are very unique, but the majority of cancers in the United States are lung, prostate cancer, colorectal cancer, breast cancer, they're not virally related, and the vaccines don't increase those rates at all.
Okay.
Yeah.
And you said something. I had no clue that HPV it can affect the face, I guess, the
mouth. You can get anal carcinoma, oral carcinoma, and obviously cervical carcinoma. So all of those cancers after the vaccination started for HPV have decreased.
Oh, wow.
Which is a good
That's
thing.
Awesome.
Yeah.
Awesome. And so we've talked about prevention, like you said, eat well, exercise, constantly get checkups. Women, as it relates to breast cancer,
mammogram starting at age 40 every other year.
So it used to be every year that women. So
so the American Cancer Society says 40 every other year, but when you get to 45, you should start doing it every year.
Okay.
And then when you get older, and that's kind of debatable what's older, but definitely after age 80, you should have a conversation about should you continue every other year.
Okay.
And some women have stopped.
Okay.
Because when we screen for cancer, we're looking for cancer early.
Okay.
That's something that's going to affect you in 10 years. So it may not have as big as an impact in older patients, the screening.
Awesome. Mm-hmm. All right. So if there was something that you could say to an individual about cancer awareness, what are some of the tips that you would share with us? Yeah.
So I think, important to talk to your doctor about your symptoms, because we definitely have had, for lung cancer, for example, we had patients that had, coughing with blood and shortness of breath and symptoms that never got better, that they never went to a doctor to talk about them until they went to an emergency room very sick. So we want people to connect with their doctors and talk about their symptoms. Coughing with blood is never normal, so that has to be worked up. Losing weight that you don't want to lose in a diet, never normal, so that should be worked up. Okay. So there's some symptoms that you should talk to your doctor about, but you also take the opportunity to make it a habit to do your screening test, which is not only for cancer, cholesterol and high blood pressure, all these things keep you healthy and keep your body from getting cancer. So I think healthy lifestyle, eating well, and moving around and doing your screening tests are critical.
Relationship with your doctor. To your knowledge, as we close out, are there any over-the-counter resources, kits, or the sort that are available to screen for some type of cancer?
That is a great question. I mean, I think most of the cancers require imaging.
Okay.
So we don't have great tests for people to do their own diagnosis. And I don't think, even for us, it's sometimes complicated to make a diagnosis. We need a lot of different specialties to come out with a real plan. Okay. We don't have, but in the future we may have imaging devices and things that will help us get answers faster. So definitely that's something that people are working on.
Awesome.
Okay, great.
Dr. Estela Rodriguez. Dr. Rodriguez, thank you so very much.
No problem.
I was anxious about getting you here in the studio, about having a conversation with you, learning more, sharing with our audience, particularly about oncology, cancer, the relationship, prevention, diagnosis, myths. So you've greatly enlightened us. I so appreciate you.
Thank you. And we're part of the Day County Medical Association that has all the specialties. So oncologists collaborate with medical doctors, and primary care doctors are really critical part of the conversation. So really fortunate to be part of this group that is about educating the community and getting prevention as a number one priority. And so the Miami-Dade Medical Association, it would be a resource for individuals that want to learn more. Yes, our members are ranged from specialists that do cancer care to a lot of primary care doctors, which are really critical. Awesome. Thank you. There you have it, Dr. Estela Rodriguez. We hope that those that are listening to us and those that are viewing us have been enlightened. I hope that, we've been able to say something. Dr. Rodriguez particularly has been able to say something that has allowed for us, whether you are a viewer or a listener, to us to learn more, better understand oncology. If you haven't, and there's some issues going on, as Dr. Rodriguez talked about, reach out to your physician and just get checked out so that we stay safe. We've got to take care of ourselves as we're getting older. Again, thank you so much. I am Dr. Maya Bird Stewart. We appreciate you for joining us, tuning in, and we look forward to having you back in the studio with us during our next health and wellness segment. Until then, stay safe.